Hello, guys. My name is Simone Price, and my partner is Monte Walker. We are students at the University of West Georgia, fall 2025. Today, our topic is when AI gets diversity wrong, the counselor's responsibility to prevent bias practices. The learning objectives for today are to recognize AI limitations in interpreting diverse behaviors, identify ethical responsibilities to prevent bias, and apply culturally responsive guidelines for AI use. Key terms are artificial intelligence, which is a system performing tasks requiring human intelligence. Predictive analysis is the use of historical data to forecast potential future trends or events and inform strategic decision making. Algorithm bias is discoverability tends to function on algorithmic biases that privilege English language, culture, content, and content produced by large global corporations. And cultural competence is the counselor's ability to understand, interpret, and appropriately respond to clients' behavior within the context of their cultural identity, experiences, and social location. The rationale for this presentation is that artificial intelligence is rapidly entering K 12 schools, shaping attendance monitoring, academic intervention, behavior prediction, mental health flagging. Yet, many of these tools were not created with diverse student populations in mind, increasing the risk of mislabeling or inequitable decision making. Counselors are increasingly asked to use AI generated insights in school. AI systems show documented algorithm biases, especially affecting multilingual learners and culturally diverse groups. Predictive tools can produce false positives for behavior, risk, and engagements. Counselors may unintentionally rely on AI in ways that conflict with the American Counselors Association's ethical and multicultural standards. So, today I'm going to talk about a peer review article in the healthcare system. It's one of the most powerful examples of AI getting diversity wrong coming from the healthcare field. A major risk prediction algorithm was used across hospitals to identify which patients needed extra support. The problem was that the algorithm did not actually look at people's health. Instead, it used how much money patients spent on healthcare as a stand in or a proxy for how sick they were. But here's the issue: Black patients often spend less on health care because of long standing barriers like limited access, distrust of medical care, and fewer opportunities to receive specialty care. So the algorithm assumed that because Black patients spent less money, they must have been healthier. In reality, they had the same or even greater medical needs than white patients. The cost equal health assumption led the system to underestimate the needs of Black patients, meaning many did not get the additional services they qualified for. When researchers corrected the algorithm and removed the bias proxy, the number of Black patients flagged for extra care more than doubled. This example shows how AI can appear objective but still reinforce existing inequalities if we do not question what data uses and how those data reflects structural racism. This same dynamic can occur in school counseling when data systems rely on biased or incomplete indicators, such as discipline referrals, attendance, grades, or behavior logs to predict which students need interventions. These indicators often reflect systematic inequalities, not actual students' needs. Just as the healthcare model misinterpreted inequitable spending patterns, school algorithms can misinterpret inequitable school data, leading to under identification of marginalized students for support or the over identifying or over identification of others for risk. Therefore, school counselors have an ethical responsibility to question the data source behind automated tools, recognize when proxies may be biased, and advocate for fair, culturally responsive systems that ensure all students are accurately identified for services. According to the American Counseling Association Code of Ethics, A4B, personal values, counselors must avoid allowing AI tools to replace clinical judgment. Counselors' plans, technology cannot override culturally responsive practice. In knowledge of technology, counselors are responsible for understanding benefits, limits, and risks of AI. Legal and multicultural considerations. Student data privacy must comply with FERPA. A big thing with AI that we have been having more conversation around is that we cannot put in students' personal identifiers because of FERPA and because honestly, with AI tools, the information can be used in different ways due to privacy. Also, and when we think of legal, AI outputs used for decision making, risk assessment, and discipline may expose schools to liability if biased. So we really don't know when we're using these AI tools where their information is going. So eventually those data pools, they can use these students' information in a school setting and really it can be beneficial to a school, but it can harm a school. But this is very important just from a legal aspect that we comply with the American Counselors Association on how we keep students' data privacy, not just students in a school setting, but also in a professional therapeutic counseling setting. And multicultural counselors must consider that cultural norms and communication, community expectation, systematic inequality, and linguistic differences. So, legally, counselors must really understand how culture impacts services. For example, working in a school setting, um, maybe a certain group, a population of people do not feel comfortable sharing information with counselors. Um, and that is normal, and we cannot necessarily marginalize them, but this is something that happens with AI if the data is only being used and not treating people as a whole person. Before I turn it over to my classmate, I just want to show you this example. It said, AI, show me a multicultural family. And then I asked it, do you understand diversity? It said people are different. This slide showing how AI can misinterpret or misunderstand diversity. When I asked the AI to show a multicultural family, it gives me four identical looking people. Then when I asked whether it understands diversity, it replied with confusion. This represents a real issue. AI often gets diversity wrong because it relies on patterns in its training data. If the data lacks representation, the system will produce narrow or stereotypical results. This set the stage for why counselors, and especially school counselors, must understand how these system works. If AI tools can misinterpret something as simple as what a multicultural family look like, imagine how much they can get wrong when identifying students' need, predicting risks, or recommending interventions. Okay, that's enough for me. I will turn it over to my teammate who will discuss the applications of AI in your school.